Oh, now I'm going to sneeze right off the bat. Excuse me. I'm going to edit this part out. Clearly. Okay. Apparently, all I needed to do was press record and that came out. All right, here we go. Hello, Puja. How are you today?
I'm very well, Jill. Thank you so much for
You are
having me.
joining me from the UK.
That's correct.
Excellent. I'm just gonna move my camera. That's what I want to do so that I'm looking at you. Because right now it's set up to be in the middle of my screen and I'd rather look at you.
Yeah,
So tell me about your life. You live in the UK. You do energy healing with muscle testing.
that's correct.
And you work with other wellness practitioners.
Mhm.
So most of our audience have a wellness practice. They're already into wellness. Lots of them will know what muscle testing is, but let's
Mhm.
talk about that for those who don't know or those that are just stumble on this from somewhere else. So you do muscle testing in order to what?
Thank you, Jill. That was a lovely introduction. I liked that. And I liked how we met and how it all clicked together, in a matter of seconds to talk a bit about like muscle testing, like we were talking a while ago. Muscle testing is a way to dialogue with a person's field, person's body, and find out what it is that is blocking their health, their wealth, and their relationship. My main interest is in health, chronic symptoms, chronic pain, autoimmune disorders, any sort of non-healing issue that a person is struggling with. So, muscle testing is a way to find out why somebody is not healing. We know there is a lot of health advice out there, and all of them are good. What you want is to find out which one is relevant to you and your symptoms.
I love that because a lot of them are good. And actually, more than one might be relevant to you as you
Okay.
go through, especially if you've got a chronic condition or an
Yeah.
autoimmune disorder. Those are complicated things.
Yeah. Yeah.
But how, and so, and I especially love that because most of the people that tune into this are wellness practitioners. So they have a wellness practice
Yeah.
and they may be struggling with a client trying to get results that they want. We had this conversation about Parkinson's and
Okay.
dentists. I don't know how many dentists are going to watch this because we're a little more frou-frou than the dentist usually.
Yeah.
But it is true that there are many really complicated um, diagnoses that can make other parts of the healing journey really complicated. So how do you help in that situation?
Okay. First of all, the way I look at it is there is no condition that the body cannot heal. This is nothing to do with me. This is nothing to do with the modality. This is nothing to do with any other practitioners or their modality. This is about what the client is going through, right? What is it that they are feeling? What is it that they want for what are their goals for their health? And what is it that they are trying to overcome? There is nothing that the body cannot overcome. Anything like big names like autoimmune conditions or chronic symptoms, chronic disease, chronic pain, fibromyalgia, autism, neurodegenerative disease, anything is nothing but the loss of information or toxicity. So rather than focusing on diagnosis or the name the doctors have given them, which is true to an extent because it helps identify like the treatment. But when we are working with our clients at Best Healing Solutions, the first thing that we do is find out what is going on underneath. Why is the body not able to see what's going on? Because if the body could see what is going on, it could heal. It's like a block, like a curtain.
Mm-hmm.
That's how we view it. So you want to find out what is going on underneath. Is it inflammation? Is it detoxification? Is it histamine? Is it methylation issue? What is it? Now, it is possible that all of these are present. The question remains, which one should I tackle first? This is exactly where muscle testing comes into picture. There could be a client with Parkinson's who needs detoxification to be the first in the order. There could be another person with Parkinson's who might need to address inflammation in the first, like in the first thing, right? So
Mm.
this is about what is the priority of the body. Let's say, for example, we spilled acid in kitchen, for example, by accident, and there was also other mess in the house. What would you say is the priority? Would you clean the house first or the acid?
Probably the acid. I'm not
True.
sure why I'm spilling it in my kitchen, but if you
True.
could see the mess of my kitchen, you'd go, "Oh my God, Jill, just clean your kitchen."
I think we all have that. I think especially the working woman, no matter how much we do, it's a daily job. But like, jokes apart, that would be the first priority. I am just elaborating so that we can see crystal clear,
Yeah,
like what is it that I'm trying to say. So what is the first thing that we need to address? Because body is trying to get rid of that virus, body is trying to get rid of that neurodegenerative disease, body is trying to get rid of that inflammation, but there is something that the body is struggling with because of which it could not get over the issue that we can see,
yeah,
if that makes sense. So this is what we call like working with the body's priority. What is the priority of your body given the symptoms that we are working at?
right. And so if as a health practitioner, I know that I need a little help. I'm a nutritionalist and I'm not getting the results I want from a client, or I'm a massage therapist and no matter what I do, things are not unwinding properly and they're not able to benefit. What happens what happens if I want to refer somebody to you? How does that work?
Sure. So first of all, any client that a practitioner is working with is their client.
Yeah,
We work with their clients, which we often do on the basis of referrals, which is like, we also have chiropractors, naturopaths on our team. So they have seen in their practice that there are 10% of clients that any given practitioner is not able to help. Now, this is not a lack on our side. This is nothing to do with us. This is to do with the person and their own journey, depending on their physiology, what is their circumstance, what is their environment in which they are living in, what are the requirements that are not met either in the past or in the present for a client. So the first thing that we do is work as a team. Whatever a practitioner, if they are a nutritionist, they do what they do best. When they refer a client to us, what we do is find out the priority. If they are on a nutritional program, is that working? One of the things that we work on a client is like find out if their treatments are online, and these treatments are not just the energy treatments that we do. These are the treatments that they have had from their nutritionist, a wellness practitioner, a naturopath, or even a doctor or a chiropractor. Just making sure that everything that they are doing is online. Is there anything that is blocking their current treatment? Oftentimes, just finding that helps the client to kind of, keep up with the journey that they are having with other wellness practitioners. And they have found this to be such a huge piece because imagine you tried to work on an issue 5 years ago and you left it because you were going in like circles.
yeah.
Imagine if we could find something that was blocking those treatments that you were having with your chiropractors or wellness, then that makes so much difference in their life because they want that thing to work. And so do
Yeah.
we. So do I. If you are going with your nutritionist, if you're going with your Reiki practitioner or any other acupuncture therapist or naturopaths, I want those treatments to work for my clients because this is a teamwork.
And so if I basically what would happen though, I would just give my client your contact information and you would reach out to them or they'd reach out to you. That's how that piece of the puzzle comes together.
Yeah, so far in the past, when I am working with a chiropractor,
Yep.
and whenever he comes across a client that seems to not respond to his treatments, they ask the client, there is such and such practitioner who can help you online. I do everything, all my treatments online.
I know we're going to talk about that in just a second.
Yeah, so that's where they don't see me as a competition. Number two, clients come to me, they book a session request form, which is their details and the things that they want me to work on, or I might get that information from their practitioner. And then there is a client history form which they fill out that gives me a brief history, like a detailed history of everything that they have gone through, so that we don't miss out on anything.
Right.
And we work on that one particular thing that they want to work on in that moment, one pressing thing.
And
My
so, and then
focus-
that makes the chiropractor look better
yeah,
because then his treatments are more effective,
yeah.
and that builds that relationship that way.
Exactly. Exactly. So what we have found is, like, instead of the client going, oh, this didn't work for me, I'm not going to go to that chiropractor again, they are rather like, oh, he's excellent, you know?
Yeah.
So this
Builds
is
your
this
authority as a practitioner. It builds your authority to be able to
exactly.
pull people in that enhance your treatments.
Yeah. And I don't do the chiropractor stuff, right? So I'm not
No.
doing that. But I can find out everything that they have done with that chiropractor. Why is the treatment not holding? You might have heard them saying, oh, I felt so good. I went to this chiropractor and I felt so good for 1 week. And then I don't know what happened. And it felt as if I didn't do any treatments, right? How many times have we heard that?
Lots. I used to be a massage therapist. That's sort of how that
Yeah.
goes. And
Yeah.
I always say it's sort of like bathing. It doesn't last forever.
Exactly.
And
Yeah.
so tell me, I want to know two things. But well, let's start with how you muscle test when
Mhm.
you're there and I'm on the other end of the world.
Sure. So have you heard of kinesiology?
Yeah.
Then
So
there is,
so truthfully, kinesiology in the UK and Australia is a whole different thing than it is here. It's
oh, is
not the
it?
same field of practice, not at all. No.
Oh, okay.
So yes, so kinesiology here
Mhm.
is basically personal training or uh like a physical exercise that you use to recover from an injury or an illness.
Okay.
And that's not what you're talking about at all.
Okay. Yeah, there could be a discrepancy there because,
Yeah,
yeah, yeah.
it just is an interesting thing to know, and I only know it because I know a lot of people. And somebody was I used to have a kinesiologist that worked with me. I had a business that did a lot of treatments for older people, and we did a lot of rehab if they'd had a fall or a health condition or whatever. We did a lot of rehab, and I had kinesiologists that did that rehab.
Oh, okay.
Yeah.
Oh, okay.
Yeah.
Yeah,
So just go back and define that for everybody that wants to know.
sure. Applied kinesiology is the scientific term that they usually use. Now, that is a face-to-face modality. You have to be present in the same room at a clinic, and the practitioner would do an arm test or something on their client.
A
Yeah,
resistance, muscle resistance test.
yeah, muscle response test, or that's also they call it. So we call it self-muscle testing
Okay.
because this is how I do it. This is my way. Now there are 22 different ways, but this is my go-to. This is mine. This is what I've been using all the. So this is how I test I do the muscle testing. This is my way.
So as your patient, I would be over here doing this, or
No,
you're doing
you're
that.
doing nothing. I am doing it for you because we are used to doing this work remotely over the phone all over the world. So you are there. I am doing it for you. This is surrogate.
Okay.
Yeah, because we are all connected and everything has a frequency. However, we can differentiate frequency, like say, of a healthy liver versus the liver that needs help.
Hmm.
We can also find out if two frequencies would match, like say, let's say, for example, if somebody is going through a fatty liver disease, then we want to find out, is there anything that they are eating which might be contributing to this? So we test their foods, their supplements, anything that they are eating. We test their environment. We test, is there any sensitivities in their environment which is contributing to this? We
So
also
do they hold that then? Like I know that used to be how you tested pills. Like you'd hold the pills in your hand as a patient. How do you test that?
That is an old method. The way we do is it's very advanced. So we just test, like say, let's say, for example, testing for Jill. If you want me to test something for you, I am testing that for you. Like say, is there anything you want me to test for you? Or just a rough
Sure,
example you want?
let's think of something.
Any supplements you want to consider for yourself or any
Okay,
food?
so I take a couple of blood pressure medicines.
Okay. Mm-hmm.
Go
So
go for it.
what do you want me to test? Whether they are good for you, whether
Are they working?
oh, okay.
Sure. I don't know. I guess I'm leaving it.
There are two
I
things
don't really
here.
know how this goes. So
No problem.
looking
Thank you
for
for
info,
asking. I
Pooja.
think, yeah,
You're the boss of me right now.
no problem. Thank you for asking. I think it's an excellent question, and there are two ways here to look at things. Number one, is there anything that you are struggling with? The answer is maybe blood pressure, right? That's why you're taking blood pressure medicines.
That is true.
Okay, so we want to find out. First of all, if we are working together, I would find out if your body is able to deal with that blood pressure naturally, and is there anything we could do to support the body?
Oh, let's do that. Let's find that out.
Let's park that for a moment.
Oh, okay.
Yeah, but if I were to test like those, let me have you say, Jill, those medications, and you are thinking of those blood pressure medicines.
Okay, do you need me to name them?
No,
Okay, good, because I don't know the names of them.
that's okay.
Okay,
Did
so
you say
blood
there were
pressure
two?
medicine.
Did you say there were two?
There's two.
Okay, just think of the first one.
Okay,
Okay, testing for Jill. Jill, let me have you say that first medication.
first medication.
I want to be healthy.
I want to be healthy.
That's testing okay. Now think of the second one that you're taking for the blood pressure.
Okay,
Now say that medication.
that medication.
That medication, I want to be healthy.
I want to be healthy.
That doesn't test well for you.
So
Now
the second one is not doing well.
yeah, let's find out. Let's find out. Let me have you say, this is helpful. That medication, is this helpful?
Is this that medication, is this
Mhm.
helpful?
No. So your body says it's nothing, it's not doing anything in your body. The first medication is helpful significantly, scale of 1 to 10, 3, 4, 5, 6, 7. So 7 out of 10, the first one. Second one, your body straight away said, no, it's not helpful.
Okay.
So now you don't want to stop it. You want to raise this concern to your doctor and you
Yep.
want to tell them, why am I given this medication? What
Okay.
is this for? The second thing I would ask is there a replacement? So instead of this, can you give me another brand?
Okay.
This is not about stopping medication. So now if we want to find out whether you really need this or not, we might have to dive deeper and find out like why they are doing, and then we would need to know the name and find out what is that doing and so on and so forth. There are plenty of things that we could do. But right now, just to give you an example, that's not helpful and this is helpful, if that makes
Okay.
sense.
Yep.
So this is not my answer. This is what your body says. Because
Okay.
you already know, your body already know what that medication looks like. It knows what it does when it goes inside, and it knows whether it's doing anything. It is like an audit.
Right.
Yeah. So when we do something like, say, business, at the end of the month, you want to find out what you've done. What is it that you can do to make this better? This is the same with the food. This is like an investment in your health. You want to find out what is it that is working, what is not working. If it is not working, is there anything I need to replace? Is there anything I need to think differently? So this is what you would do.
Right.
Mm.
Now, can we answer the question is what I could do naturally that would help me get my blood pressure under control?
First thing is that I want to know, like, why is the blood pressure a problem in first place? Why did the body not kind of take care of it, right?
Right.
So then I would go in and find out with the help of cell surface receptor. That is an advanced scan that we teach at level 2 at Best Healing Solutions. And we would find out, okay, what is contributing to this high blood pressure? Is there a plaque buildup? Is there an inflammation? Is it something to do with the kidneys? What is it? So that is an hour-long scan, which would help
Okay. So we're
It
not
would,
going to do that right now, is what you're telling me. We'll have to
well,
book that separate.
well, it's a lengthy scan,
Right.
right? So we need to know like everything about you, like the history. I can just kind of go in and say, okay, this, and that. But then, for the purpose of this video, let's just go ahead and find out like roughly what is it that's blocking you,
Yeah,
right?
let's do it. Just so
Yeah.
that
We
people can
want
see
an
what would happen
overview.
in a session.
Yeah.
And yeah,
Yeah, we want an overview. That is what I can show you. I'm happy to.
perfect.
Yeah, yeah. But just so you know, like this is like a whole umbrella scan
This
that
is
is
not, for those of you watching from home, this is not complete. Don't expect your session to look like this.
no, no.
Okay.
Okay. Okay. Let me have you say, Jill, there is something that is blocking my blood pressure from healing.
There is something from blocking my blood pressure from healing.
Your body says yes. Okay. Let me have you say, this is man-made.
This is man-made.
No, this is biological.
This is biological.
No, this is non-physical.
This is non-physical.
That's correct. Your body says it's non-physical. Man-made, no. So the priority is non-physical.
So does that mean it's a mental health thing or stress?
No, so we don't guess. As I said, this is not a guessing game. We just go ahead and ask. Okay, we now know the first category that we need to look at is non-physical, which
Okay.
means emotional side of it. There is nothing wrong. It's just the body trying to show us something. It's a messenger, and we are trying to decode. We are detectives right now.
Okay.
Okay, so let me have you say this is a blocked or frozen emotion.
This is a blocked or frozen emotion.
This is a belief, intention, contract. This is a specific time zone. Yes, this is trauma. Okay. Your body says this is a trauma. Okay. The contributing factor. What I'm looking for right now is what started everything for you. Your body says this is non-physical and the priority is trauma. Something more than one, more than two, more than three, more than four, more than five, 5.5 years ago.
So about that time, I was also in the hospital with myocarditis. And it was truthfully, it was a really, really, really stressful business time. Like I had my own business. It was a wellness practice. I had staff that were difficult. I had clients that I was trying to make happy, the whole thing. And that's around 5.5 years ago. I think that was all happening.
Now, is this the same time when this started for you, the blood pressure issue?
So the blood pressure was maybe a little bit before that. Like I'm going to say that actually was about 7 years ago, but honestly, if it was a trauma that involved that period of time, I would say it was business related trauma.
Mm-hmm. Now, let me have you say this is true.
This is true.
Your body says yes. It is still kind of holding that trauma. Now, I would need to know where it is. So let's just bear with me one moment. Something is blocking. Yes. The most stressed organ gland tissue testing for Jill. Here, no, here. Okay. Let me have you say, Jill, this is here.
This is here.
I'm just testing some charts here. This is like an anatomy chart. So the first thing that comes up is kidneys. Kidneys.
Kidneys.
Mm-hmm. So the trauma that you went through 5.5 years ago related to business, it affected this ability of the body to overcome blood pressure issues. What is the organ gland tissue which is involved in this? Because normally when there is an issue, it's
Yeah.
not on its own. There are other things that's contributing to this.
Right.
Like I said, we are detectives. I want to find out, okay, we know there is a blood pressure issue. What else is involved? What else is stressed? I will go on with my list if I was on a session and I
Yeah.
will be whole list, like everything that is involved. Find out everything that's not working in this field of blood pressure. Then
Okay.
we would like to know what is blocking. Is this something that you are eating? Is this something you're breathing? We call them the toxin scan and the physical scan. So this is about, we categorize them into four. Inhalants, everything we inhale. Contactants, anything that is touching your skin or it's contacting you. The third is ingestants, everything that we are eating. And the fourth is injectants, anything that would pierce your skin. So we would find out in each category what is blocking blood pressure from healing, what is blocking kidneys from functioning properly. We would also test for frequencies of pathogens, anything bacterial, anything virus. In your case, if we test the kidneys, the thing that the priority that comes up is biological. In terms of, when I say biological, I mean there is some sort of frequency. So I would go ahead and test what frequency is that? Why is the body not able to take care of that virus, bacteria, fungal, whatever it is? So
Mm-hmm.
when I say you're fighting a virus, this is how I would test. So let's say testing for Jill, okay, fighting a virus. Yes, your body says being challenged by a virus, there is a viral frequency resonating in this field. Yes. Hidden virus. Yes. How many? More than zero, more than one, more than two, more than three, more than four, more than five. There are five viruses in total, hidden and normal. So why is the body not able to see it? Is there anything we need to do about that? I am dialoguing with your field right now. There is also a non-physical field there. Yes. This is a blocked or frozen emotion. Yes. This is Jill's emotion. Yes. Something else here, here, here. It's fear. It's fear. Does that resonate with you when you were talking
Made me
about
want to cry. Like I had a very verklempt sort of feeling right then.
that? That's a good thing. I don't want you to cry right now. You look good now. But yeah, if
Later I can cry.
that is all releasing. So it's like you're hitting the right spot. So your body is like, oh, I have been waiting for you to discover this for so long. I'm so glad you discovered me. It's like meeting an old friend. I'm so glad we met, right? So in a way, it's a good thing because you're releasing it, right?
Right.
Yeah. Yeah. So this is what it would look like. Any organs, gland, tissue that's not connected. Why is it not working? If you are doing something else, like you said about the medications, right? Is the body kind of utilizing that medications properly? Is it harming you in any other way? Can we do something to stop the harm and take the benefits? Can we do something to replace those? So this is how you see this is a complementary. This is not about, oh, you don't need that medication, you should just stop it straight away and rather do this. No, it's not about that. This is about what is it the team of practitioners, the medical team, the paramedical, the alternatives, the complementary, the energy medicine practitioner can do to make Jill better right now.
Awesome.
This is where I'm coming from. Thank you.
And so now we've seen how it works. And as we were talking just before we got on air, we were talking about money blocks and relationship issues and other things that you can help people heal within your treatment sessions. So if because I think often we know that things are not working perfectly.
Mhm.
And sometimes we think we know what the solution is, or we might even know what the solution is, but implementing the solution feels either too big or impossible, or it just doesn't happen. So
Okay,
as a practitioner or somebody who's running a small business, there are a lot of stresses.
sure.
And so if that was so if you're looking as a practitioner for yourself, things that can help. So first of all, just obviously the physical. And I think most of us have physical things that are not perfection.
Mhm.
And sometimes those things can work really well for a really long time, but then they just sort of they gather debris, and as we get older and wiser and smarter, our body gets more and more clogged down.
Yeah.
with some of those things that are causing problems. And so you can help people with so practitioners with their own stuff too, whether it's physical or mental or emotional.
Yeah.
And then we've seen how if you're a nutritionalist and you're trying to treat maybe my high blood pressure by making me eat more pineapple and it's not working. I'm simplifying, of course. That calling in Puja could really help help your client get the results they want, and also turn you into a hero with your client, because then what she's going to do and what you're going to do together are going to cause a positive reaction.
Absolutely. Yeah. I am so glad, Jill, that you brought up the thing about like what can we do at a personal level, right? Because we always say like doctors need doctors, healers need healer, coaches need coaches, right? So as much as we are helping others, there are for sure areas where we need help.
Yeah.
Now, our practice, our personal life, our health, our relationships, and our business, all of this is interconnected. We might be wearing different hats at different time, but it's all one. It is we who are conducting that, right? So, so one thing that I would recommend to any of the listeners who have their own practice is something that has helped me a lot is keeping your side of the street clear.
Mm,
Working on yourself all the time. You can decide what works for you, whether it's every week, whether it's every month, whether it's a yearly thing.
right.
Ensure that we keep our side of the street clear. The rule that we follow is anytime anything comes up for us, we pause and we work on ourselves. Find out, like, what is it that this is trying to show me? What is it that I need to do right now? So, this is how you keep your side of the street clear. Because if we don't, you are going to hit a point where you will be burnt out, stressed, and all of a sudden we will find that we are in the middle of nowhere and we don't know how to help ourselves.
Yeah.
How many times have we felt burnt out, myself included?
Oh, right.
Sure,
Yeah.
sure. This is what we are talking about. So I know it's hard, it's easier said than done, but start with small, like small amount of time. Take 5 minutes for yourself every day. Do what you know. If you don't know, go out, ask for help, anything that you know. Ask for help. I think that's what I would say.
So, and here's what I'm going to say as we wrap up the show. So, and I do this at the end of every show, Pooja, because I love, I love success stories. And it's great for you and I to talk about me and you and how this can help in theory. But what I really love is if somebody is watching this, all of Pooja's contact information is in the show notes. And if you refer a client to Puja and you have great results as a result of that, I would love to get you back on the show to talk about how using this partnership enhanced your business. Or, and either way, if you also reach out to Puja and she helps you with overcome whatever it is, whatever hurdle it may be, I would also like to get you back on the show to talk about how that changed things for you. And I'd really love to do it like the three of us get back and we can have a natter about what changed, what was hard, what was easy, what the process felt like, so that we just have like that proof of concept thing, right?
Yeah.
Like it's all great to talk about this, but it's also these things are a little esoteric and not everybody goes, oh, I'm going to try that right away. Sometimes you need a friend to do it first. So if you reach out, you can be somebody else's friend and help them on their healing journey or help them figure out their practice. Is there anything we missed, Pooja? Like, what did we miss?
I think there is lots we can talk about, but I think we've covered most of it, given the,
We'll
yeah.
cover other things as people reach back out to us. We'll do a series. We'll do a
Sure.
series 15
Sure.
people are going to reach out to you and they're going to call me back and we'll do a series of how this helped.
That's the feedback loop, isn't it? I love
That's
that.
the feedback loop. Awesome. Well, have a fantastic day. I'm at the startish of my day. I think you're at the endish of your day. And so the wonderful world of time zones and Zoom.
Oh, yeah, yeah. I would just like to add on a closing note that, if there is anything that resonated with you around the talk that we just had in the past half an hour, quarter to hour. So I offer a free 15-minute to clients if they want to learn more about, but this is also for a practitioner. So if you have any questions or if you want to learn more about something, just book that free 15 minutes call. The links will be under
The
in the
links will be in
caption.
the show notes. All of the links are going to be in the show notes. Yeah,
Yeah,
absolutely.
yeah, yeah, yeah.
Awesome.
I'd love to chat with you.
Perfect. Have a wonderful day.
Thank you, Jill. Thank you. So do. Yeah.